Have you ever been so broke and need a medical procedure and try getting one at a public facility? But actually getting it feels like an Olympic sport with no finish line? Because that's where I'm at. I need a root canal. I'm trying to save a tooth, not audition for a pirate role. I've already spent everything I can afford on exams, consultations, and x-rays. And then, plot twist, the private dentist who happily took my money tells me they can't do the procedure and hands me a referral to another private dentist. One who will charge me 3 times my income. Because that's what they say it costs. Cool. Love that for me. So I do what you're supposed to do. I go to my community clinic to get referred to the government facility. And this is where the real circus begins. Now listen, I rarely go to clinics, because historically, they don't help me. But the system now says, if it's not an emergency, you must go to your community clinic first. If they can't handle it, then they refer you to the hospital. Sounds reasonable. In theory. In reality, it took me 3 entire days just to try to get a referral. Day 1. I show up early. Doesn't matter. There's already chaos. People arguing about who came first, who slept outside, who saw sunlight last week, who deserves a number, and it was just a few of them. I'm told I need to make an appointment, but only in the afternoon. So that's a full day wasted. Can't go to work, can't go home properly, can't teleport. I don't drive, because if I could afford a car, I wouldn't be here begging for dental care. Day 2. I come back for the appointment. Only 3 other dental patients. We're all given numbers. Very organized. Allegedly. Except somehow, people with no numbers, no emergencies, just walk in and get seen before us. They also take forever. This is just my observation. But wow, time really stretches when accountability leaves the room. Eventually, I get examined. The dental aide tells me they need to check which age group they're currently dealing with at the government clinic. She comes back with a face that says don't get your hopes up and tells me I need an x-ray. I say, great, I already did one few weeks ago. Can that work? She says yes. I call the private dentist. They email my x-rays immediately. I rush back to the clinic, thinking I'm being efficient. Nope. They won't accept email. They won't accept a screen photo. I must bring a printed copy the next day. Day 3. I bust my ass to get the x-ray printed. I come back to the clinic, and I'm immediately questioned about why I'm so late. Late for what? You just came in. The aide isn't even at work yet. She literally walks in after me. They finally take the x-ray printout and then tell me I need, surprise, another appointment, this time to see the doctor. At this point, I'm running purely on spite. I wait almost 2 hours. The dental aide finally calls me in, just to say, we'll contact you. Which for me, in clinic language, translates to, no, never. Good luck with tooth decay. And this is exactly why I hate clinics, because it feels selective. Like maybe I made a mistake by honestly writing that I work. Maybe that was the trigger. Like, oh, she's employed, send her to private care. As if they know my bank balance. As if employment equals money. Let me give you context. I grew up going to hospitals for everything. Then policy changed. Too many emergencies. Too many gunshots, stabbings, real trauma. Non-emergencies were redirected to clinics. Fine. I adapted. I went to this same clinic for asthma medication the first time the change occurred. They said they couldn't help and needed to consult my regular doctor. Translation. Go pay private fees. Then, that private doctor gave me a prescription with no repeats, so I'd have to come back and pay again. I went to the same clinic for a growth on my knee. The doctor said it was beyond their capability to even examine and refused to give me a referral. Said it looked superficial. Implied I just cared about how I looked and that the clinic was not owned by him. Duh. I stared that man directly in the eyes and imagined several things. I left furious. Someone who worked there saw my face and quietly told me to go to another clinic outside my community. I did. That doctor was kind, competent, and honest. He said this has been happening frequently. and many persons have been coming in who were refused help at my first clinic. He wrote the referral on his last day there and told me plainly, the medical problem I had is not superficial. At the hospital, they told me I needed imaging. Sent me to the department, where 2 technicians told me the machines were down. From the look on their faces and body language, I could tell they were lying. I was sent to get private imaging, expensive imaging. The technician I acquired was overseas. 2-week wait. 3 days later, after making the appointment for the imaging, my leg said, absolutely not, and burst open. Infection everywhere. I went to emergency. A doctor tried to send me home, on a Sunday, to go private. He stated they did not do that kind of work there. I refused. Asked for dressing, while blood and fluid were literally leaking onto the floor. 2 hours later, a real doctor saw me and was furious. Asked who tried to send me home. Ordered an immediate X-ray. Guess who did it? The same 2 technicians. With the broken machine. Just so you know, I checked with the doctor 3 days ago about whether the machine was down. She confirmed it wasn't and said she's been receiving all requested X-rays. Turns out my condition was serious. I nearly got admitted. I was rushed to orthopedics. A minor surgery was done on the spot, under cell phone lights. Thankfully, I was discharged the next morning and told to return every 3 days to my first clinic for wound care. That didn't work either. I ended up doing it myself. So yeah, when you hear about billions given to countries like mine for healthcare and then taken back, you wonder why. This is why. Because the care exists. The money exists. The equipment exists. But actually getting help feels like surviving a reality show where the prize is sometimes basic dignity. And people wonder why some of us have anger issues. Honestly, I'm surprised more of us don't.